How is the Y-lift different from a liquid facelift? The Y-lift procedure, according to Dr. Trokel's website, is performed using a specialized titanium instrument, which is inserted beneath the skin and then maneuvered throughout designated parts of the facial region to instantly lift and contour. What exactly is the titanium instrument? Is it similar to liposuction, laser lipo? The doctors on here so far do not really discuss this part of the procedure, but only go on to talk about how it is really just like getting HA fillers injected.
Thank you for your question. You're asking how is a Y-lift different from a liquid facelift? Well, I can certainly answer that question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon practicing in Manhattan, Long Island for 20 years, and I am the first physician to be trained by the inventor of the Y-lift on the method, and I actively perform Y-lift in my offices in Manhattan and Long Island. So I can help you understand a little bit, and this is certainly it's very understandable why you're confused by the terminology, and you're focused in on the titanium instrument, but really there's a very basic understanding that it differentiates Y-lift from liquid facelift. Liquid facelift came out as a concept many years ago, and essentially the term facelift to a surgeon, someone like myself who does surgical facelifts, has been so reinterpreted by different in different ways for different perceptions or interpretations of what facelift means. So a facelift for a cosmetic surgeon is a surgical facelift to bring everything upward to restore definition, to restore angularity of the face. In that way, there's a certain overlap with Y-lift, except there's no surgery. With Y-lift, what we're doing is adding volume to the structure of the face, which is below the muscle and in the bone level. This is an area that dermatologists don't go to. I mean, a surgeon, a plastic surgeon, cosmetic surgeon, oculoplastic surgeon, routinely who does facelifts, cheek implants, chin implants, fracture repairs, knows this area very, very well. And this is where the confusion is. A lot of dermatologists will offer something called a liquid facelift. And I don't mean just dermatologists only, but anybody who offers injectables will offer liquid facelift procedures. Typically that's a combination, and an artful combination, but still a combination of using a neurotoxin like Botox or Dysport and fillers such as Radiesse, Juvederm, Restylane, to add volume in places where there's volume loss, but limited to the soft tissue, defined as the dermis or the backbone of the skin, and just under the skin, the subcutaneous level. What you have, or many people have seen with celebrities, is that with the fillers, the face can become very pillowy, and that is a very unattractive look. That makes you look very doughy, and it certainly doesn't make you look younger. A younger face has structure. So with Y-lift, what we're doing is using this titanium instrument to place the material, which is usually a filler that is long-lasting, such as Juvederm or Voluma, at the deeper level, under the muscles of the face in a very specific way, and creating improvement of angularity of the cheekbone, of the vertical aspect of the jawline, the chin. So you can actually get a facelift appearance. It is such that so many people, including, if not especially colleagues in our field in surgery who will look at results and look in disbelief and believe with no uncertainty that the procedure is really a surgical procedure. But it really does take a very short period of time because the method is so elegant and so precise. It does require a lot of filler, and that often can be cause people to hesitate and think, how can you put so much in my face? Well, when you're putting it at the structural level and you understand volume loss with aging, it's actually not a lot. When you put filler more superficially, you can be limited to 1 to 4 syringes, nasolabial fold, the cheeks, and other areas, which is still useful. But with Y-lift, we're putting it much deeper. We want to differentiate structural volumizing from just routine application of fillers. So I think it's best now to actually meet with somebody who performs the Y-lift and learn if this is the right procedure for you. I always explain to my patients who come in for consultations for Y-lift is that you don't necessarily have to have the full procedure, because if you don't need certain elements of your face enhanced, then we don't necessarily have to do it. But what's really beautiful about this concept and this method is that you can use it to be very specific. You can use it for a jawline. You can use it for the cheeks. And it really has been transformative in our practice in a way to help bridge a very needed space between people who are non-surgical, need volume, and people who need facelifting. Typically, it could be a woman in her early to mid-40s who keeps in shape and has good overall structure but has lost definition. We find that this has been a really great solution for this particular age group. But it goes beyond people as young as their mid-30s to people in their 60s. We have been able to use this method to help them look their best. It all depends on individual facial anatomy in the end. So I hope that was helpful. I wish you the best of luck. And thank you for your question.